Menopause. It comes up with a lot of ups and downs. As the estrogen levels decrease, body temperature and weight may increase. So, how do you balance on the roller coaster ride that is menopause? Menopause is a natural transition in a woman's life as her menstrual cycles comes to an end. It is confirmed 12 months after you had the last menstrual period. However, the transition and the symptoms associated with menopause can last for several years. Most women experience menopause between the age of 45 and 51, and it is usually around 51 years. Symptoms associated with menopause: hot flushes and night sweats. Hot flush refers to a sudden feeling of heat in the face, neck, and chest, often accompanied by flushing of the skin, perspiration, sweating, palpitations, and acute feelings of physical discomfort which can last for several minutes. Changes in the regularity and flow of the menstrual cycle, culminating in the cessation of menstruation, vaginal dryness, pain during sexual intercourse, and incontinence, difficulty in sleeping, and changes in mood, depression, and or anxiety. Body composition and cardiovascular risk can also be affected. Women's advantage over men in terms of cardiovascular disease gradually disappears with the significant decline in estrogen levels after menopause. Menopause can also result in the weakening of the pelvic support, increasing the risk of pelvic organ prolapse. Loss of bone density contributes to high rate of osteoporosis and fracture. While menopause can be linked to many uncomfortable symptoms and increases the risk of diseases, the diet may help to reduce the symptom and ease the transition. Hormone estrogen begins to decline, disrupting the normal cyclical pattern of estrogen and progesterone. Fortunately, making changes in the diet may help to relieve menopausal symptoms. The foods to eat. There is evidence that certain foods may help to relieve some symptoms of menopause, such as hot flushes, poor sleep, and low bone density. The decline in estrogen levels during menopause can increase women's risk of fractures. So, calcium rich foods are to be taken. While dealing with hot flushes and night sweats, the bones are going through changes of their own throughout the menopausal cycle. This may not be something that you feel right away, but bone loss becomes more prevalent during this time and can even lead to conditions like osteoporosis. The bone is building up till the age of 30, and after that you start losing bone. Since you are losing that estrogen around the menopause, there is an accelerated decline of bone. Dairy products like milk, yogurt, cheese contain calcium, phosphorus, potassium, magnesium, and vitamin D and K, all of which are essential for bone health. Dairy may also help to improve sleep. Healthy fats. Healthy fats like omega 3 fatty acids may benefit women going through menopause. Foods highest in omega 3 fatty acids include fatty fish like mackerel, salmon, anchovies, and seeds like flax seeds, chia seeds, and hemp seeds. Whole grains. Whole grains are high in nutrients, including fiber and B complex vitamins like thiamine, niacin, riboflavin, and pantothenic acid. A diet high in whole grains has been linked to reduced risk of heart disease, cancer, and premature death. Whole grain foods include brown rice, whole wheat bread, barley, wheat, and rye. Fruits and vegetables. Fruits and vegetables are packed with vitamins and minerals, fibers, and antioxidants. So, the dietary guidelines recommend filling half of the plate with fruits and vegetables. Cruciferous vegetables may be especially helpful for postmenopausal women. Dark berries may also benefit women going through menopause. Phytoestrogen containing foods. Phytoestrogens are compounds in foods that act as weak estrogens in the body. Foods that naturally contain phytoestrogens include soybeans, chickpeas, peanuts, flaxseed, barley, grapes, berries, plums, green and black tea. So, include these in the diet. Quality protein. The decline in estrogen from menopause is linked to decreased muscle mass and bone strength. So, women going through menopause should eat more protein. Guidelines recommend that women over 50 eat 0.55 grams of protein per pound or 1 to 1.2 gram per kilogram of body weight daily or 20 to 25 gram of high quality protein as per meal. Lean proteins are grilled chicken, tuna, turkey, lean beef, lentils, and beans. Soy products. Soy from food products may alleviate hot flashes and night sweats in women and help to ease the menopausal symptoms because they contain phytoestrogens, a chemical that is similar to estrogen. So, what all foods to avoid? Added sugars and processed carbohydrates. High blood sugar, insulin resistance, and metabolic syndrome have been linked to higher incidence of hot flashes in menopausal women. Processed foods and added sugars are known to raise the blood sugar rapidly. The more processed a food is, the more pronounced its effect on blood sugar. So, limiting the intake of added sugars and processed foods such as white bread, crackers, baked good may help to reduce the hot flashes during menopause. Alcohol and caffeine. While avoiding alcohol and caffeine doesn't mean that you have to cut caffeine completely. Excess caffeine has been shown to make those heat waves more severe. Moreover, caffeine and alcohol are known sleep disruptors, and that many women going through menopause have trouble sleeping. So, if this is the case for you, consider avoiding caffeine or alcohol near bedtime. Caffeine and alcohol can trigger hot flushes also. High salt foods. The decline in estrogen increases the risk of developing high blood pressure, so reducing the sodium intake may help to lower this risk. Moderate sodium diet in women has led to better overall mood. To summarize, menopause is linked to changes in metabolism, reduced bone density, and increased risk of heart disease. Additionally, many women going through menopause experience unpleasant symptoms like hot flashes, poor sleep, and mood changes. A whole food diet, high in fruits, vegetables, whole grain, high quality protein, and dairy product may reduce menopause symptoms. Phytoestrogen and healthy fat, such as omega 3 fatty acid from fish, may also help. You may want to limit added sugars, processed carbohydrate, alcohol, caffeine, and high sodium or spicy food as well. These simple changes to diet make this more important transition in your life easier.